Hello, and welcome to Module 2, Gardening and Dementia, Unlocking the Past. Dementia is a common set of conditions affecting daily life, a person's sense of being, and at least two brain functions, such as judgment, memory, cognition, abstract thinking, and many others. It is progressive in nature, and it is not a normal part of aging. It's also marked by personality changes and vision impairments. Behavioral and psychological symptoms include agitation, wandering, emotional outbursts, restlessness, and feelings of fear, depression, despair, and anger. Healthcare professionals originally thought that these symptoms were due to deterioration of the brain, and they relied heavily on medication. They now believe that these symptoms are also linked to the person with dementia trying to communicate a need, such as hunger, thirst, loneliness, fear, and/or confusion. One of the most important things to remember about interacting with a person with dementia is to meet the person where they are. You want to create an environment that will help bring this person back to their baseline. Each person is unique and has their own baseline, but after spending time with an individual who has dementia, you will understand what their baseline is. You'll want to center therapeutic activities around emotional, behavioral, cognitive, and sensory-based interventions that provide familiarity. And again, as people say, don't expect an activity to always go the way that you planned it. Instead of focusing on ensuring that a specific task is completed the way that you would normally expect it to be completed, meet the person where they are and understand them from their own point of view, and acknowledge that they might not be able to complete it in the way that someone without dementia would. There are best practices for effective communication for positive interactions. A lack of agitation reducing interventions by those who interact with residents or people with dementia daily carries a trickle-down effect to the residents or other people with dementia. Research shows that one of the most effective interventions to reduce agitation is to encourage appropriate communication of the staff and the volunteers. And just to let you know, we have the ability to use our interactions with the residents as a means to increase positivity and to reduce agitation. So you might be wondering, how do you effectively communicate with one of the residents who has dementia? You'll want to speak in short, simple sentences and give the person time to talk without interruption. You'll also want to remain calm if they are taking a bit more time to respond to you. What you don't want to do is take what one of the residents says personally, unless it could directly harm them, you, or others. You don't want to tell them that their perceptions aren't real or that they're wrong. You also don't want to ask direct yes or no questions because that could confuse them. A lot of times, if they have to recall something immediately or answer something that they need to think about, it confuses them. And then don't ask them to recall facts. Don't ask them about who so-and-so in their family was or where they used to live. That's something they might bring up on their own because it's not like memory retrieval. It's just them talking conversationally. And then if they're telling you something, like they're asking for their mom or their dad, or they're saying their dad's waiting for them, don't tell them that their dad isn't here or that they're wrong. Just remember feelings over facts. So you'll want to validate their feelings and gently divert their attention to something else. So if they say, my dad's waiting for me, you can say something like, oh, don't worry, he knows where you are. Well, and then say, come on this way because everybody else is going this way. So just something to kindly divert their attention, but also let them know that you're validating what they say. So last week we talked about gardening in older adults. This week we're talking about dementia and how to communicate with the residents here who have dementia, which brings us to the activities that I am going to lead. I'm going to be creating an indoor garden along with a therapeutic garden activities. So research has shown that people with dementia, especially those who have gardened in the past or who have helped with gardening, um, this helps them reminisce more. It helps them engage more socially and emotionally. It might help them with memory recall. And it provides a sensory-based intervention for them that also helps to calm them, especially if they're feeling agitated. So, research does show that gardening is a sensory-based intervention that provides familiarity and soothes behavioral and psychological symptoms of dementia. It allows the person to tap into long-term memories and recall their own gardens or those of loved ones. This is especially important because it promotes social and emotional engagement, whether that's between one resident to another, or between a resident and a member of the staff, or between a resident and a volunteer. All of these benefits work to reduce the behavioral and psychological symptoms of dementia by providing a sense of meaning, purpose, and familiarity. There will be more information to come about the activities that will be incorporated once the indoor garden is set up, so look forward to those. Thank you for your time, and please let me know if you have any questions.